Good morning, all of you. Today we will discuss about toxicohistopathology of organophosphate poisoning. I am Dr. Jay Kumar Chaurasia, Associate Professor, Department of Pathology and Lab Medicine, AIIMS, Bhopal. The histopathological findings in an organophosphate poisoning depends upon duration of exposure of the poison, dose of exposure, which may be a slow dose or an acute poisoning, and also on the type of organophosphate, which may be a volatile or a non-volatile form. It also depends on time since death. Now, coming to the basis of histopathological alteration in tissues due to the organophosphate poisoning. It occurs due to the irreversible inhibition of acetylcholinesterase and generation of reactive oxygen species and production of DNA alteration or the DNA defects. There are, in the literature, there are few articles which demonstrate and document the histopathological finding in organophosphate poisoning. These are some of the original articles. These articles stress on the fact that liver, kidney, and endocrine organs such as adrenal and thyroid are mostly affected in organophosphate poisonings, although lungs, skin, oral mucosa, pancreas, and brain can also be affected. These all organs are affected because of the metabolism of the organophosphate. Liver is basically involved in the metabolism of organophosphate, resulting in accelerated glycogenolysis, proteolysis, and lipolysis. Similarly, kidneys are also involved as they eliminate the organophosphate poison depending upon its liposolubility. Endocrine organs are also involved as glucocorticoid and catecholamine secretions occur, resulting in exaggerated cholinergic stimulation. Lungs can also be affected because of the cholinergic overstimulation, and which may later result in respiratory arrest. So coming to the first histopathology, which is of liver, which is mostly affected in organophosphate poisoning. The basic histopathological finding includes centrilobular vein dilatation, congestion, sinusoidal dilatation, vacuolar degeneration of hepatocyte, reactive changes in hepatocytes, centrilobular necrosis, bile stasis, periportal inflammation, and Kupffer cell hypoplasias. All these pictures I will be showing on the histopathological slides. So this is the first slide. You can see that there is a central vein which is very much dilated. In both these pictures, you can see that these veins are dilated, surrounded by the hepatocytes and sinusoids. This is on the higher magnification. You can see these sinusoids which are dilated and congested in picture 1 and 2 both. And there is evidence of cholestasis also in the form of brown pigment in the cytoplasm of the hepatocytes. Similarly, this picture shows that there is periportal inflammation. So this is a central vein surrounded by chronic inflammation in a periportal region. Now this is showing the bile ducts. Both pictures are showing the bile ducts surrounded by the chronic inflammatory cells. So there is inflammation around the bile ducts. This picture shows the hepatocytes with cholestasis. Now coming to the kidneys. Kidneys are also involved in the organophosphate poisoning. There are changes in the glomerulus, tubules, and interstitium. The kidneys are mainly involved in the elimination of the byproducts of the metabolism obtained from the liver. So in the glomeruli, we can see there is capillary dilatation and congestion. One of the important features is the glomerular atrophy. In the tubules also, we can see acute tubular injury, necrosis, dilatation of the tubules, cloudy swelling, peritubular congestion, hyaline cast, which is called as thyroidization, And in the interstitium, we can see inflammation. I will be showing these pictures on the histopathological slides. So this is the first slide. You can see that these are the glomeruli. In the first picture, you can see two glomeruli. One is the big one, and the other one is a smaller one with lot of empty space. So this is an atrophic glomeruli. The second picture shows the higher magnification of that atrophic glomeruli where the capillaries are retracted and there is atrophy of the glomerular tuft. Surrounding which are the tubules. You can see that the tubules are also dilated in this picture. Similarly, this picture shows glomeruli where you can see that there is capillary dilatation of the glomerular tuft. So this picture shows the tubules. The tubules show thyroidization or the hyaline cast. You can see on the low magnification that these are the casts and these are the secretions and the hyaline cast in the tubules, which is one of the feature of organophosphate poisoning. Now again, this picture shows that the tubules are highly dilated and there is the lining epithelium of tubules is not showing the nucleus. So these are like, you can say that there is dilatation of tubules with cloudy swelling as well as acute tubular injury. Coming on to the lung. Lung may show alveolar damage, septal thickening, septal inflammation, congested septal capillaries, peribronchial inflammation, congested large vessels, hemorrhage, and extravasated RBCs. Lungs are basically involved in the organophosphate poisoning as they most of the time there is cholinergic stimulation, and later when there is downregulation of the nicotinic receptors, this leads to the respiratory arrest. So these are the pictures which we can see that there is diffuse alveolar damage in the lung parenchyma. The alveoli of the lung are usually separated by the septa. Here the septa are destroyed and the alveoli coalesce to form the big spaces. So there is a diffuse alveolar damage which can be found in the lung parenchyma. So this is the same picture. You can see that this is a normal lung parenchyma on the lower side, and on the upper side you can see that there is diffuse alveolar damage. The lung can also show edema, and you can see on the histopathological slide that the lung alveoli are filled with the proteinaceous alveolar fluid. Coming on to the septa are dilated, congested, and you can see that the septal vessels are congested in both the pictures. In these pictures, however, we can also identify megakaryocytes. These megakaryocytes can be seen in many other causes of death, such as including poisoning or any asphyxial death. So this megakaryocyte also signifies that there is restriction of the oxygen exchange and the gaseous exchange, resulting in the megakaryocyte which are visible on histological sections. So this picture shows that there are congested vessels. This is a large vessels which is thrombosed, and adjacent alveoli showing the alveolar damage or the diffuse alveolar damage. Coming on to the endocrine organs. Endocrine organs mainly are adrenal and thyroid and pancreas, which can be affected by the organophosphate poisoning depending upon the time of exposure and the dose of exposure. Adrenals may show congestion, inflammation. That there can be a vacuolar degeneration of the fasciculata cells and chromatin margination of the cells of the adrenal. So these are histopathological clues by which you can say that the poisoning has occurred. So we will be seeing the pictures. So these two pictures show that there is vacuolar degeneration of the fasciculata cells. The cytoplasm is having a vacuoles. This is the picture from electron microscopic picture, where you can see that this is a fasciculata cell where the cytoplasm shows vacuoles and this is the nucleus. Similarly, this is also showing that there are chromatin features in organophosphate poisoning, which is particularly chromatin margination. You can see that there is chromatin which is marginated towards the periphery of the nucleus. Similarly, coming to the thyroid may also show that organophosphate poisoning feature. There is usually a reduced colloid in the follicles, foamy transformation of the colloid, and mitochondrial damage. Now, this picture shows that these are the thyroid follicles which show reduced colloid inside their lumen. And this second picture, you can see that this is a thyroid follicle which is having the foamy histiocytes inside the lumen and which is called as the foamy transformation of the follicles. So these are peculiar findings which are mentioned in the literature in organophosphate poisoning. Similarly, there is a mitochondrial damage in thyroid also. This is an electron microscopic picture which shows that this is a mitochondria which is damaged here. Now, any organ can also be involved, such as pancreas, stomach, skin, which are in direct contact with the organophosphate poison. These may show changes such as necrosis, apoptosis, abrasions of the mucosa. My take-home message is that histopathological findings are of immense help in correlating and confirming the clinical and autopsy finding. Almost all organs can show histopathological changes in organophosphate poisoning depending upon the exposure, duration of exposure, and the dose, and also depend upon the type of organophosphate poisoning. It can aid in establishing the cause of death where other circumstantial shreds of evidence are lacking. As many organs as possible should be subjected to histopathological examination to see the changes and confirm the cause of death. With this, I end my session. Thank you.